Imagine having a baby, and you need a C-section, but you have good insurance. Everything's fine until you get a bill in the mail telling that even though your hospital was in network, your anesthesiologist wasn't, and now you're on the hook for a lot of money. Welcome to part 2 of the Trail Talk episode of healthcare. The Biden-Harris administration has set up rules using the No Surprise Act to end surprise medical bills like these, including emergency medical care and helicopter ambulance. Kamala Harris plans to pressure the next Congress into expanding this to cover traditional ambulances too. Kamala started the rollout of her healthcare policies to a crowded rally during a speech that included lowering grocery prices and the housing crisis, things we've covered in previous episodes. See, that's something unique about her campaign. She's approaching healthcare the same way real everyday people see it, as a kitchen table economic issue. She reckons planning their budgets worry more about paying for healthcare than they worry about paying for gas or even for rent. Biden and Harris have been able to enhance the Affordable Care Act to lower premiums for millions. An extra 9 million people have insurance than in 2020, and Americans now save $800 a year on average. They successfully passed policies that will allow Medicare to negotiate prices for many more prescription drugs, beginning with the most vital and most expensive. They lowered the monthly cost of insulin for seniors from up to $400 to just $35. In mid-August, they announced that the price of tens of the most expensive common medications covered by Medicare will be lowered to about 80%. Once more, the out-of-pocket prescription costs for Medicare patients can no longer go above $2,000 a year. The list of prescriptions they can negotiate is already scheduled to increase every year. But Kamala has proposed a plan to speed that up. Her proposal includes ways to expand all of these price caps, and not just for our seniors, but for everyone who's still cutting the $200 billion in government spending. The Medicaid expansion they helped us achieve allowed Governor Cooper to start a program to forgive $4 billion of medical debt for 2 million low and middle income North Carolinians. She has put forward plans to include dental and vision coverage in Medicare. She and Biden are already pushing Congress to require all insurance plans to start offering just as much mental health care as physical health care, and to extend Medicare incentive programs to address shortage of mental health professionals in rural and underserved communities. Abortion is definitely a part of the healthcare conversation, but it's one that we think should get its own episode. So join us next week while Dylan takes a deeper look at it. Until next time, this is Trail Talk.